A potential listeria outbreak has people on high alert. The CDC says one person in Illinois is dead. 23 people in 10 states have been affected and admitted to the hospital. More than half of the listeria infections originated in Florida. And now we're joined by Dr. Anthony Harris, HFIT Health Medical Director and CEO, live tonight from Chicago. Dr. Harris, thank you so much for joining us. What are the first things to look out for with a potential listeria infection?
Sure. Well, thank you first, Natasha, for having me. The things we need to look out for listeria, listeriosis, it's caused by bacteria, and it's caused by food, right, that we eat. Prepared foods, meats, poultry, cheeses, unpasteurized dairy products as we prepare for this July 4th holiday. And it's typically causing, for most people, healthy individuals, what's called non-invasive disease. That means it doesn't affect other organs. It causes gastroenteritis, upset stomach, diarrhea, and fever, right? And it usually onset is about 24 hours after you consume the contaminated products and produce that may have been prepared from contaminated soil. So those are the symptoms that, first and foremost, the majority of people would need to look out for.
How would one of us know to tell the difference between a listeria infection and something like run-of-the-mill food poisoning?
You know, Natasha, most of us will not, right? Even as healthcare professionals, we don't even distinguish between unless it is actually cultured or tested in a laboratory, right? And so for the vast majority of individuals who encounter and become infected with listeria, it's not reported and it's not diagnosed because the symptoms usually subside in about 48 hours after onset. In fact, only about 0.24, less than one individual out of 100,000 encounter or are infected with listeria annually in the U.S. However, there are some risk factors that we need to be aware of for individuals. If you're pregnant, if you are in the extremes of age, young, neonates, or older adults, you should be wary of any illness that onsets after consumption of food in this category that we're talking about, because you may have a 10 times risk of having listeriosis.
Yeah, and what is the threshold for most of us? At what point do we need to go to the hospital and actually seek treatment versus just treating it at home?
Absolutely. So with any diarrhea type illness, right, particularly like we're talking about with listeriosis, if you're unable to keep even things like water down, right? Hydration is key. That's what really hurts individuals when we're talking about gastroenteritis. The diarrhea causes dehydration and not being able to rehydrate, particularly with electrolytic fluids, electrolytes, is concerning. And it can be life-threatening, as we've seen with the fatality from listeriosis here in Illinois. So if you find yourselves multiple days of diarrhea, not able to keep food down, seek advice from your physician or go to the hospital for sure.
All right, we so appreciate your time. Dr. Harris, thanks so much for joining us.
You bet.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.